So we are starting the phase. So here we have to study the facial muscles, blood supply, nerve supply. Nerve supply में we have two types of nerve supply, the sensory and motor. Sensory innervation and motor innervation. Motor innervation, motor nerve, and some short notes. Short note on muscles. Short note on some muscles. So these are the things we have to study. So these are the topics of the phase. So now we are starting the first some points. In phase, there is no deep fascia except last time we have seen on the parotid gland. We have seen the parotid gland have parotidomesenteric fascia. Parotidomesenteric fascia. Just. And other all regions have we don't have any fascia. Then and all muscles of face. First, muscles of face Muscles of face are subcutaneous. Muscles of face are subcutaneous means they are present below the skin. Because the role of the facial muscles are they are the facial expressions. They control the facial expressions. So they are subcutaneous. Basically, they are attached to the skin. Attached to skin. Attached to skin. These are attached to the skin. Then and they are all facial muscles are modification of some muscle, a single muscle which is present in the lower animals. All facial muscles are modifications of a single muscle of a muscle called panniculus carnosus. Panniculus carnosus. It is a muscle present in lower animal, which is present subdermally and help in moving the skin. Present in lower animals, basically dogs, cats, इनमें होती है this muscle. This muscle help in moving the skin and help in moving skin. Skin को move करने में help करती है. Done. So these are the some points about muscles of face. Now we are starting the facial muscles. Now we are starting the facial muscles. Facial muscles. So here we are starting. So first we draw a diagram of face. Let's say this is our skeleton, skull. This is our skull. This is mandible. Anterior view है. This is mandible. This is orbit. Hmm. So this is our orbit. This orbit. Hmm. Just don't mind the drawing. This orbit, and here is, these are the lips. We draw the muscles. Here is nose. Done. So we are drawing the muscles. Let's say this is the orbit. So the muscle near around the eye. There is a muscle present around the eye. This muscle is called orbicularis. Of, orbicularis oculi. Orbicularis oculi. Then these are the present around the eye, which help in closing the eye. Then next muscle which is present near the nose. Let's say this is the muscle. Hmm? This is muscle present both sides. This called nasalis muscle, which is present near the nose. Nasalis, nasalis muscle. Done. Next, we know there are the lips present here. These are the lips. We just draw. Hmm? These are the lips. Done. So here they are the four muscles present in this region. So we draw first muscle which is go from the lip to the then nose then to eye. This is the huge big muscle. Then this huge big muscle is called levator labii. Labii for lips. Labii superioris because it elevates the lips. Superioris. Alique for nose. Alique. Alique nasai. Alique nasai means nose को भी lift करता है. Done. This is the whole big muscle. Levator labii superioris alique nasai. Then there is another muscle present which help in only lifting the lips like this. These are present in similar order, fixed order. Then this muscle is called levator labii superioris, only for lips. Superioris. Then Then there are another two muscles present. One is which go from lips to the zygomatic process. One is two muscles. One is zygomatic minor and another is zygomatic major. So one is zygomatic minor. This is zygomatic minor. Zygomatic minor, and another is zygomatic major. This is major. This is a big muscle. This is zygomatic major. Zygomatic major. Major. Done. First we let's say this is the lip. Done. So these are the four muscles. First is levator labii superioris angularis or equinesi levator labii superioris, zygomatic major, zygomatic minor. Done. Next, these same muscles also present in this side also. Done. Now we know the point. Here, this is the superciliary arch. We know the arch present. This is the superciliary arch above the eye. So here is muscle. So here is muscle present. This muscle is called corrugator supercilii, which is present on superciliary arch. Corrugator supercilii. Supercilii. Then corrugator supercilii. Then another muscle which is present on the glabellar region, which is present here like this, near the glabellar region. It present in it. The role of this muscle is for transverse wrinkling on the nose, above the nose, just transverse wrinkling. This muscle is called procerus. Procerus present on the glabellar region. Done. Next, there and another above we know these are the frontal belly of the occipital frontalis muscle. We know here is the muscle frontal belly of occipito frontalis muscle above region. We know very well. Next is there is a muscle present which help in long lengthening of the lips. Basically, longitudinal lengthening of the lips like this. If there is a muscle which lifting the lips in this direction, stretching the lips. So there is a muscle here present like this. This muscle is called rhizorius muscle. Rhizorius muscle. Rhizorius muscle. Done. Help in smiling. Basically, smiling के लिए वर्क होती है. We can write the role of the muscle. It help in frowning. Basically, anger में frowning. frowning, for anger expression, anger wala, for showing anger. Then this is the transverse wrinkling, transverse wrinkle, wrinkling on nose. Then this help in smiling, basically longitudinal stretching, smiling. Done. And there is another muscle present here which help in elevating the angle of the lips. You can write which help in lifting the angle, just angle, which represent angle region, like this, just lifting the angle of the end angle of the lip. This muscle is called levator angularis, angularis oris. Remember, these are the or muscles of the near the mouth, no? So these are the muscles of mouth. Now there is a muscle of mouth which help in closing and opening of the mouth. There is a big muscle present near the mouth, like this, which is present all around the lips. This is the pattern of the muscle, and all of these muscles attached to this muscle. This muscle is called orbicularis, orbicularis oris. Remember, around the eye is orbicularis oculi. This is orbicularis oris. Orbicularis oris. Then now another muscle is this is the eye region. This is the whole region. Then and another muscle is these are the muscles of the which help in elevating the lips. Now there are some muscle which help in depressing the lips. Same here is muscle which is present on the mental symphysis menti. This is the mandible region, and here is the ligament called symphysis menti which help in joining the two mandibular parts. So here is a muscle called symphysis menti. So this is the symphysis menti. This muscle is called symphysis menti. Symphysis muscle. Mentalis muscle, basically. Mentalis muscle which is present on the symphysis menti. Then, sorry, mentalis muscle. Mentalis muscle. Then, which help in wrinkling on the chin. Basically, chin. Wrinkling on chin. Basically, doubt wala expression show करने. Basically, these are the expression for doubt. Wrinkling on chin. Then, next there are the muscle which help in depressing the lip. So here is a muscle which help in depressing the lip. All these muscles present on both sides. Remember, this help in depressing the lips. So this is the levator labii superioris. The similar muscle is depressor labii inferioris. Depressor labii inferioris. Inferioris. These are just one elevating, one depressing the lip. Then remember, this is the muscle which help in elevating the angle of the lip. So there is another muscle which help in depressing the angle of the lip. Basically sadness expression johari, for sadness expression, like this, attached to the angle, like this. This muscle is called, यहाँ पे नेमिंग कर देते हैं. This is the levator angularis oris. Levator angularis oris. So this is depressor, depressor angularis for angle depression, angularis oris. Done. So these are the muscles of the face, all muscles of face. And the one last muscle which is, this is a rhizoris muscle. If we remove the rhizoris, there is a muscle present which is attached to the teeth. Here is, you can name this muscle, which is helping, which is present in the cheek region. Basically, this is called buccinator muscle. Buccinator muscle. Then, so these are the muscles of the face, all muscles of face. First is frontal belly of the occipitofrontalis muscle. Then for frowning anger action के लिए corrugator supercilii. Transverse wrinkling of nose is procerus, which is present on glabellar region. This is present on superciliary arch. And around the eye region there is muscle called orbicularis oculi. Then around the nose there is muscle called nasalis. Then there are four muscles in the sequence. First is levator labii superioris aliquot nasi. So this muscle help in lip, nose to the eye. These help in both lifting, lip and nose. And another is muscle levator labii superioris, lifting the lip. Then these are the zygomatic minor and zygomatic major. Then help in elevating the angle of the lip. This is called levator angularis oris. Then this help in lengthening of the lip, which is basically smiling action, rhizorius. And another side, if we remove the rhizor, there is a muscle present buccinator. Then on the symphysis mentae, for doubt expression, we have mentalis muscle. And there are two muscles which help in depressing the lip: levator labii, depressor labii inferioris, and depressor angularis oris. These are the facial muscles of the facial muscles. The whole facial muscles. These are the facial muscles. Done. So here we mark it in this picture. So this is the facial muscle. Here we mark. So this is frontal belly, frontal belly. Then this is orbicularis, ocularis, oculi. Then there is muscle. Here we can count. This is the procerus muscle. This is procerus muscle. Then this is nasalis muscle. Nasalis muscle. Another is around the mouth. This is orbicularis oculi. Oris, sorry, orbicularis oris. Orbicularis oris. Then this is mentalis muscle. This is the mentalis muscle. Mentalis muscle. And another is, this is the whole big muscle of levator labii superioris aliquot nasi. This is, we mark. So here we mark above. levator labii superioris ris aliquo nasi. Then this is levator labii superioris. These are in sequence. Levator labii superioris, and these are the two muscles, zygomatic major and minor. We can write zygomatic, matic, one पहले minor आती है, then major. First is minor, then major. Zygomatic major. Then another muscle we can mark here is, if we remove this muscle, this is the corrugator supercilli. This is corrugator supercilli muscle. Then next we have, this is rhizorius muscle. This is rhizorius. Rhizorius muscle. Done. And another is this muscle. This is called depressor anguli oris. Depressor anguli oris. Then this is depressor labii inferioris. This is depressor labii inferioris. Labii inferioris. Just above, just opposite name of the levator labii superioris. Inferioris. Done. And this is the muscle which is present in neck. This is called the platysma muscle. We can write here. This is platysma. Platysma. Done. So these are the muscles. Now if we remove the rhizorius, we can find this is the buccinator muscle. This is buccinator. Done. And this is the corrugator supercilli. If we remove the orbicularis oculi muscle, this is the corrugator muscle. Done. So these are the muscles, and now these are the muscle after removing the platysma. We can write name corrugator supercilli. Done. So these are the muscles of face. Done. Next, we are starting the blood supply of the face. These are the things we have covered. Facial muscles, face, all. Now we are starting the facial blood supply. Facial blood supply we have covered. Now, Hmm. So next we are starting the blood supply of the face. Blood supply of face. Done. So here this is the skull. Let's say this is our skull. So here we know there is a platysma present in this region. Platysma and the investing layer, which is this the deep cervical fascia of the neck. This deep cervical fascia of neck present like this. Done. And in front like this. So this is the deep cervical fascia of the neck. And now inside we know there is a carotid fascia, and in carotid fascia there is an artery come out which is called external carotid artery. Then internal carotid artery is present inside the carotid fascia, which is go inside the skull and supply the interior region of the skull, basically brain, cerebrum, all these things. And the external carotid artery which supply the outer side of the face and give a branch. So we draw. First we draw a bone. We know there is a bone present in the just below the mandible is a called hyoid bone. This is the hyoid bone, like this. This is the hyoid bone. This is hyoid bone. Done. And here is the artery come out, which is called external carotid. This is the external carotid artery. Then there is a branch come out of the external carotid artery, which is called the facial artery. This is the facial artery. This is the greater corner of the hyoid bone, just above the greater corner of the hyoid. There is an artery come out. This is the present inside the deep cervical fascia. But if we have to supply the face, so we have to pierce the deep fascia of the neck. So first it go inside the mandible, behind the angle of the mandible, like this, and then it come out. Now here, this is the point where it come out, and now it pierces the deep fascia and come out to supply the face. Here it pierces the deep fascia. Done. And now it gives many branches. So first we take note. Facial artery, branch of external carotid artery. Done. Go origin कहाँ से इसका? This is the greater corner of hyoid bone. We can name it greater cornua of hyoid. This is the hyoid bone. Now it go inside mandible, deep to mandible, deep to mandible. Then again turn back, turn down, go down at base of mandible, base of mandible. Then pierce deep fascia. Then pierce deep fascia of neck. pierce deep fascia of neck. Then it pierces the deep fascia of the neck, and now it gives many branches. First, it go like this. First, is give the branch to the basically lower lip region. Then it gives another branch, which is called the upper lip region. Then it go branch to the nose region, and there are four another branches come out as facial artery, which supply the face. So we draw the four arteries. Mm, wait. Done. Hmm. These are the four arteries. Now there are four another branches come out as submental. Basically, one supply the mental region, submental. There are the four branches come out which supply the face. Tonsillar, submental, glandular, all are. First we draw the naming करते हैं इसकी. This is inferior labial artery. This is the superior labial artery. Superior labial artery. Then this is artery. Then this is the this is the whole facial artery. We can say this is the facial artery which supply the nose, lateral nose, nasal. We can say this is the lateral nasal. Lateral nasal. These are the three branches. Then this go inside the orbit and join the one another branch, which is the superior ophthalmic artery. We can say it go inside the orbit as angular artery. We can say this is the angular artery. Angular artery. There are another four branches of the facial artery. Is we can draw here. These are going different regions. So we draw here like this. Similar pattern. Not only this region, basically these go different region. One is we can write name is submental mental artery. It will go like this region. And draw. Submental artery is going in this region. This is the submental artery, not this. Wait. So there is a submental artery. We only draw the branches of the facial artery. And this submental artery go into this region like this. Present the in the lower to the mental. Now there is another artery, another branch of the facial arteries. We draw in different pen. This is a different branch. We can say this is the tonsil artery, which supply the tonsil. Tonsillar artery. The another artery, another branch of this. This is one branch. Another branch we can say this is. This another branch is called, the name of this is, called ascending palatine artery. Palatine artery. Done. And the last branch of this, there are the seven branches of the facial artery. We can draw the last branch. We draw here. This is last branch. We don't draw the correct position of the artery. Just we draw the facial artery which supply the face. Like this. This is last artery, which is called glandular artery. Glandular artery, which supply the basically parotid gland, submandibular gland, this region. So they are the four arteries: submental, ascending, palatine, tonsillar, glandular. We can write this artery like this: stag, S T A G. We can write these four branches like this: stag. And these three are inferior labile, superior labile, and lateral nasal. So these are the branch facial supply of the facial arterial supply. Done. And you can say this is the greater corner of the hyoid bone. This is the greater corner of the hyoid bone. Done. So we can write here the branches of facial artery. Branches of facial artery. Basically लिप के लिए अलग आर्टरी है, सुपीरियर नोज के लिए अलग आर्टरी है, some mental, different artery, facial artery. We can write here. First arteries, we can write lateral nasal. We write roll also. Lateral nasal for nose. Done. Second is superior and inferior labial arteries for lip, upper and lower lips. Done. 2 or 3. These are 2 or 3. Then another is submental and subtonsillar. Submental, Submental artery for basically mental region, mentalis region, basically where the symphysis menti present, near symphysis menti, symphysis menti. Then another is stag. So S T is tonsillar. Tonsil rays go inside and supply the tonsil region. Basically, it go near the mouth, inside mouth. For now, we can write. We will discuss later again. This is the tonsil region, inside mouth. The pharyngeal tonsil, all these tonsil region. Next is ascending palatine, ascending palatine for palate region, basically mouth, roof of mouth, roof of mouth, and tonsillar region also. And the last is STAG, last, glandular artery. Then last is glandular artery. Glandular artery for submandibular gland, submandibular, all these areas, submandibular gland, mandibular and and parotid region. Parotid is the mouth region, this cheek region, parotid glands. Done. So these are the which supply? Arterial supply. Now we can draw this is the arterial supply of the face. Done. All arteries. We can write here the name of the arteries here. This is the 1, this is the 2, this is 3, 4, 5, 6, 7 and 8. 8. This is the terminal branch of the facial artery. And 8. And these are the branches, and this is the terminal facial artery which go inside the eye. And we can write here the terminal branch, terminal artery. It is terminal, termination of facial artery. Facial artery is angular artery. Angular artery for eye region. We can write eye. Then now we go to the venous supply. So this is the portion we have covered. Arterial supply, muscles. Now we go to the venous blood supply. So here we start venous. This is arterial supply. So here we discuss the venous supply. Then here we discuss the venous supply. Portion we have covered. venous supply. Venous supply of face. Then, so for venous supply, this is the similar pattern of the vein in of face in venous supply, like this, like artery. This is a similar pattern of vein. So here we draw only the vein. First we draw the skull. Let's say this is the skull. This is the orbit. This is the nose. Hmm. Then this is the mandibular region. This is the eye. This is the nose region. Done. This is the whole portion. So here this similar vein come like this. This is the facial vein. It has similar branches like this. One branch is inferior labile, another branch is superior labile, vein, then lateral nasal vein for nose. Then this the similar vein go inside the eye is called angular vein. All this. That this is the venous pattern. Another vein come as above. There is a vein present inside the maxillary vein. This is present inside the skull. Maxillary vein. This is inside, not the face. Facial vein is like this. This is the facial vein part. That and from the above is superior superficial temporal vein. This is inside portion. Remember, this is the inside portion, not above. Then it come out. And here this is the region then where the parotid gland present. This is the mandibular region. Mandibular region. This is the now it's superficial. This is superficial vein. This is the deep vein which go inside the skull. And here is the parotid gland present. This vein go behind retropharyngeal vein. We can say this is the retropharyngeal. Now this retropharyngeal divide into two. One is joined with this anterior branch, this joined to anterior branch, and another is branch like this. For the occipital region, there is a vein come out. This is called posterior occipital vein. This is the posterior occipital. Then this joint, and these veins again open in different veins. Then this is the whole pattern. This is the common facial vein. So first we can write name. This is angular vein. These are the facial vein. Angular vein. Lateral nasal. Superior labii. Superior labial and inferior labial. Superior and inferior labial veins. Done. These are the veins. Now this is the superficial temporal. This basically is present like this side, and go to the lateral side of the skull to the above. This is the superficial temporal. This is for temporal region. We have write the temporal region. This is the superficial temporal vein. Superficial the superficial temporal vein. So this is the superficial temporal vein. This is the superficial temporal vein, and this is the maxillary vein for deep structures. Maxillary vein for temporal region and for deep region. Then this is the posterior occipital vein for the posterior occipital region. Posterior occipital vein. Occipital vein. This is the retropharyngeal vein. Retropharyngeal vein. Done. And this is the anterior and posterior division. Anterior division fused with the facial vein. This is the facial vein. Facial vein. This is the anterior division. Anterior division. And this is the posterior division. Rear division. Then the posterior division drain into the external jugular vein. We can say this is the external jugular vein. Remember, posterior division. Posterior division is this. This is the posterior division. This is the posterior division. This. This combine the occipital vein, posterior occipital vein, and then drain into the final the external jugular vein. This is the external jugular vein. External jugular vein. This is the external jugular vein. Then this is the external jugular vein. This is the posterior vein. So this is the pattern. And this vein drain into the internal jugular vein. This is the external jugular vein. This is the internal jugular vein. This is called deep facial vein, common facial vein. We can say this is the common facial vein. Let's say if we draw, this is the common facial vein. We can write and then finally drain into the internal jugular vein. We know there are the two veins, internal jugular and external jugular. This is the external jugular and this is the internal jugular. Internal jugular vein. Then this is common facial vein. After fusion with anterior division, common facial vein. So this is the venous supply of the skull face. This is the facial and this is the side temporal region. This is the posterior region. This is a similar arterial pattern present in the arterial supply. We will discuss in the external carotid artery region. Then this is the part of this part. This is the arterial supply. External carotid artery. This is the external carotid artery. We know. You can draw here external carotid artery course. external carotid artery also give a branch. This is the facial branch, which is the posterior occipital artery, similar to the posterior occipital vein. This is the posterior occipital artery. Then another branch of the external carotid is similar, retropharyngeal. We discuss the later, this part later. Then superficial temporal. All these are similar pattern present in the external carotid. This is the posterior occipital artery. You can see posterior occipital artery, branch of external carotid. This is the branch of external carotid. These are the branches of the facial artery, and this is the branch of the external carotid. Facial artery is also branch of external carotid. Then there is another artery of the external carotid. This is the similar venous pattern, like we know the superficial temporal artery, like superficial temporal vein, and another is maxillary artery, like maxillary vein. These combine and form the retropharyngeal artery, like retropharyngeal vein, like this, and then bring into the then is the branch of the external carotid, like this. Here is the parotid gland present. This is the parotid gland region. Behind the parotid gland, the similar pattern. We can say these are artery. This is maxillary artery, maxillary artery. This is superficial temporal, superficial temporal artery. These are branches of external carotid. Remember, temporal artery. These three are 1, 2, and 3. These are branches of external carotid. External carotid artery. If we name it, external carotid artery. This is external carotid artery, and these are branches of this external carotid artery. Facial artery is also a branch of external carotid, and these all are facial artery branches. So this is the arterial pattern of the face and skull, and this is the venous pattern of the face and skull. Done. So this is the portion we have covered: arterial supply, blood supply, and the venous supply. Done. Similar venous pattern like arterial venous pattern, vein का. Similar pattern, बिल्कुल just similar, ditto copy. So here we can write the veins. Naming कर देते हैं veins की. 1, 2, 3, 4. These are the terminal veins. Basically, these are the terminal veins. 5, 4. We can say 4 is this. 6, 7, 8. Then divide the posterior division, anterior division. Posterior वाली remember, posterior वाली external carotid में drain करती है and out, and anterior वाली internal jugular vein में. This is the external jugular vein. This is external jugular, final drainage, and this is the internal jugular. These are the two different veins, remember, and different drainage. Anteriorly internal jugular होती है, posteriorly external jugular. The internal jugular present होती है carotid sheet के अंदर, and external jugular present होती है, it pierces the carotid sheet, then come out. So this vein pierces the carotid sheath for supply. Then so this is the venous supply. Now come to the nerve supply of the face. Nerve supply of face. So there are two nerve supply. We know the facial, the sensory, and the motor. The facial supply carry the sensation, touch pressure, and the motor supply carry the muscular movement. So here is sensory supply and motor supply. Sensory and motor. Sensory for pressure and sensation, and motor is for muscle supply. This for touch, pressure, sensations, and this is the motor supply for muscle movement, muscle facial expression, for muscles of face, muscles movement. Then for sensory supply we have which nerve? Remember, we know that there are 12 cranial nerves present in brainstem. We have learned in 12th. These are the 12 cranial nerves. So the fifth nerve is the sensory supply of the face. Fifth is trigeminal nerve. Trigeminal nerve is sensory supply. And for motor supply, we have facial nerve. Facial is for motor and sensory for trigeminal. Done. And for eye rotation, there are again many nerves. 3, 4, 6 for eye movement. Then, so we first draw the motor supply. First, we draw the motor supply. So, in temporal region, basically this side region, we know there is a gland present in this region. Let's say this region. We know this region. There is a gland present. This is called the parotid gland. This is the parotid gland. We know this is parotid gland. So behind this region, inside the parotid gland, there is a facial nerve come and form the 5 branches which supply the face from the inside of the parotid gland. There are 5. So first we draw the motor supply. Let's say this is the parotid gland. Then facial nerve come and go inside the parotid gland. Then it forms the 5 branches. This is the facial nerve, 7th nerve. This is the 7th nerve. And form the 5 branches. For above, basically this is the temporal branch. Temporal branch, temporal nerve. There are the 5 branches. One is temporal nerve. Another is zygomatic. Zygomatic nerve. Then another is buccal nerve. marginal mandibular, marginal mandibular, mandibular nerve, and the last is cervical nerve. That these are the five branches. Is being supplied the nerve. Basically, this is the most superficial, so it supplies the muscles, frontalis, the basically the forehead region muscles, frontalis, upper portion of orbicularis oculi, upper orbicularis, orbicularis oculi, and corrugator supercelli, rhizoris. All these muscles supplied by temporal. Then zygomatic nerve. This is the lower orbicularis oculi supply the lower belly, lower orbicularis oculi, ocularis oculi. Then buccal nerve is for the basically the upper buccal buccinator muscle, and for the upper lip region, basically the levator muscles of lip. Buccal muscle, buccinator muscle, buccinator and levator muscles of lips, lip. Then this is the lower lip muscle, basically depressor muscles. Depressor, depressor anguli oris, depressor labii inferioris, all depressor muscles of lip. And this is the cervical region. Cervical region, we have platysma muscle. So this is for platysma. Done. So these are the muscle motor supply of the face. This is, you can write motor supply. Motor supply of face. Now come to the sensory supply of the face. For sensory supply, we know the nerve is trigeminal. So here we draw the sensory supply. चलिए ये भी draw कर देते हैं sensory supply. Sensory supply of face. Sensory supply is slightly bigger. For sensory supply, we draw a face. So this is the sensory supply of the face. So first, this is the sensory supply of the face. So there are the three branches of the trigeminal nerve which supply the different regions of the face. So first we draw the regions. Let's say facial region. This is the region one. This region. Second is this region, and the third, the last is this the whole region. So there are three regions supplied by the trigeminal nerve, and the fourth is this. This is not supplied by trigeminal nerve but also included in the face. Remember, this is not supplied by trigeminal nerve. This. So there are three branches of the trigeminal nerve supply. So here we draw like this. Let's say this is the trigeminal nerve from the behind. So it has three divisions. One division is supplied this region. One division supply this region, basically nose wala region. Done. And the one supply this region. Done. So these are the three regions supplied by the nerves. So first is this. This is the first region. This is second region, and this is the third region. And whole face is covered now. So first region is supplied by ophthalmic division of trigeminal nerve. So we can call ophthalmic nerve. Second is again division of trigeminal nerve, which is called maxillary nerve. Maxillary nerve. And the third last area is again supplied by trigeminal nerve sensory. All these are sensory sensations, which is called mandibular nerve. Mandibular nerve. Then these are the branches. These are the branches of the trigeminal nerve. Branch of fifth nerve. Fifth nerve. This is the basically the lower near the mandibular region, lower the marginal mandibular, basically, and near the auricular region. Kanwala. This region is supplied by again the not a branch of mandibular nerve, trigeminal nerve, but is cervical branch. This is supplied by. This is fourth area. It is supplied by great auricular nerve. Only region great auricular nerve supply. Great auricular. Remember, this is the nerve which is present in the head region behind the ear. So great auricular nerve. Root value is C2, C3. Then, so this is the sensory supply of the face. In anterior region, we can write again. This is the region where supplied by ophthalmic nerve. Done. This is the region where supplied by maxillary nerve. This is the region, and the whole is supplied by the this. This is the whole region supplied by maxillary, and this is the whole region supplied by the mandibular nerve. Done. So we can write 1, 2, and 3. This is supplied by this for this, and this is for this. So this is the sensory supply of the face. Sensory sensation, touch, pressure, all these sensations are supplied. Now come to the short note of some muscles. They are the some muscles which we have learned. That here is we start the muscle short note. Muscle short note. So first muscle is our orbicularis oculi. There are some muscles we have to read in detail. Orbicularis oculi. Then it has three parts. So first we draw the orbit. Let's say this is our orbit. We draw the square. Then so there is a fascia present here. Then this, let's say this is the medial side and this is the lateral side. This is the anterior. This is the lateral side. Medial side we have some important things. The lacrimal region. This is the fascia which is called tarsus. These are called tarsus. Basically the fascia. Fibrous fascia. Then this is the lacrimal region, lacrimal crest and lacrimal sac. Lacrimal sac and crest. The lacrimal region. We learned this in later detail. Lacrimal crest. And here is a present in orbital where here is a tubercle present which is called Whitnall's tubercle. This is a tubercle present in the lateral side. This is the lateral, this is the medial. This is called Whitnall's tubercle. Whitnall's tubercle. Then and here is a this side a ligament form which is called this ligament. We can say medial lacrimal ligament. Lacrimal ligament. And here is lateral lacrimal raphe. This is raphe, this is ligament. Lateral lacrimal raphe. Done. So there is a muscle present. This orbicularis muscle has three parts. One is most outermost, inner, and most innermost. Done. So first we draw a first part. Turns like this. So here we draw three parts of the muscle. So A part is this is the outermost part. The first part is orbital part. This is the orbital part. Done. We have to form a table. The second part and third part. The second part is like this. The second part again at origin from this and go inside to the this portion. Done. This is called orbital. This is called palpebral part. The second part is palpebral part. Palpebral part. Palpebral part. Done. And the third part is, which is most innermost, is called lacrimal. Lacrimal part. Done. It is present here. Go like this. This is the lacrimal part. This is the palpebral part. This palpebral part not only present above, below also. This is the palpebral part. And this is the orbital part. Done. These are three parts. So we can name here. Outermost is orbital. Middle is palpebral. Innermost is lacrimal. Done. So now we draw the table for origin, insertion, all these. Origin, insertion. Let's say we draw origin, first aid table. And this is the table. So here we draw the things. This is the origin of muscles. Origin. Wait. Origin of muscle. Insertion and role. Role of muscle. Done. This is the name of muscle. Which muscle? Part. Parts of muscle. Done. First part is our orbital. So orbital part has origin is like it originates from the medial lacrimal ligament and go around eye, go and go around eye, complete circle, form complete circle, form complete circle. complete circle. Done. Insertion is on the same thing. Medial lacrimal ligament. Lacrimal ligament. Go turn around, complete from the this the part. This the this the outermost is the muscle orbital part. It originates from the medial lacrimal ligament, then go above, turn around the eye, and then again insert at this point. This is the complete circle. So role is tight closing of eye. Tight closing of eye. The next part is palpebral part. Palpebral part. For this is this medium. This is slightly lateral to medial lacrimal ligament. Lateral to this muscle. Lateral to origin of this muscle. Lateral to medial lacrimal. Lateral to origin of this. Lateral to origin of orbital part. Orbital part. Done. And insertion in the lateral lacrimal ligament. Lacrimal raphe. This lateral side is raphe, not ligament, and the role is gentle closing of eye. Gentle closing of eye. The next is third part is lacrimal. Again, origin is same. Origin is origin of this is lacrimal crest. Done. And fossa. Lacrimal fossa. Basically, this is the portion of the bone, lacrimal crest and lacrimal fossa. Just a fossa for lacrimal gland. Depression. Lacrimal fossa. And insertion is similar. Lateral, we can say this. This is, let's say this is the lacrimal sac, lacrimal fossa, lacrimal sac, we can say lacrimal sac and lacrimal crest. This is the origin point of the lacrimal part. Then this muscle go and insert to the lateral lacrimal raphe. This is the lacrimal part, and this is the palpebral part. Origin from the medial lacrimal ligament to the lateral lacrimal raphe. Done. This is the above. This only this muscle form the complete circle, not these parts. So done. Lateral lacrimal raphe, and origin is work is delicate lacrimal sac. Basically tears के लिए होता है lacrimal sac. Done. So these are three parts of the this muscle. Done. This is a table for this. So this is a short note of the first muscle. Which muscle is orbicularis oculi? This is the important muscle for short note. This is the portion we have covered. Now the another muscle is buccinator muscle. Next muscle is buccinator. B is buccinator muscle. It again has three parts: upper, middle, and lower. It again has three parts. So let's say we draw the skull region. Then let's say this is the mandibular region. Here is the mandible present. This is the mandibular region. Remember, this is the mandibular region. Remember, this is the eye. So here is a ligament present, which is called pterygomandibular raphe. This is the ligament called pterygomandibular raphe. So here this ligament, three parts of the buccinator originate. First part of buccinator is go to the upper lip region. This is the first part of the buccinator. All have origin from this raphe. This is called pterygomandibular raphe. Lower part is from this. Done. And the middle part has crisscross fibers. Middle part crosses above fibers, go to the downwards like this. And the lower fibers of middle part is go above and crisscross with this. These are the three parts of the buccinator muscle. This is the buccinator muscle. So we name it. This is buccinator muscle. Sorry. This is pterygomandibular raphe. Pterygomandibular raphe. Done. These are the upper fibers. Upper fibers. Lower fibers. And these are the middle fibers. Crisscross connection. Middle fiber have crisscross connection. Crisscross connection. Done. Crisscross connection. All have origin. Three parts origin have. Origin is pterygomandibular raphe and insertion is lip. Origin is fixed. All have fixed origin and fixed insertion. Pterygomandibular raphe and insertion is lip region. Lip. Done. So these are the two muscles short. This is the orbicularis oculi muscle, and this is buccinator muscle. Done. So this is the portion, all things we have covered. These are things we have covered: facial nerves, facial muscles, all muscles, facial nerve supply, blood supply, arterial supply, venous supply, motor supply, and sensory supply of the face. Then short notes: orbicularis oculi muscles and buccinator muscle. Done. Here we can slightly correct it. Skeleton. It's not look like skeleton. This is the eye. This is nose. This is the skeleton portion. Then this is the raphe. This is the raphe where superior constrictor also present. Superior constrictor. This is the muscle of the pharynx. Then we can write, not important. Here is a superior constrictor also present, like this. This is the superior constrictor of pharynx. Superior constrictor constrictor of pharynx. Then so these are the portion of the face. Then thanks. So next time we cover the next thing. Another. Thank you.